Newsfirst Newsline.
Hello there, a very good evening and welcome to another edition of Newsline, coming to you live and direct from our Newsfirst studios here in Colombo. Today's discussion is in keeping with the current COVID-19 situation in the country. It's a very important debate that is taking place within the country right now, and the question is hard. The answer, even more so. Lockdown to save the lives of the people, or no lockdown to save the economy of the country? Where do you stand? What should we do? Of course, tonight to discuss these matters and more, we've got on our show two professionals in the field, very knowledgeable on the subject. Of course, on my immediate left is Professor Indika Karunathilake. He's the former chairman of the Sri Lanka Medical Association and the vice president of the Organization for Professional Association of Sri Lanka. We also got to my far left Dr. Anil Jayantha, also a person we've had on Newsline before many times. He's the chairman of the National Intellectuals Organization, also a lecturer at the Sri Jayawardhanapura University. A very good evening, gentlemen. Thank you very much for taking time off and coming on the show.
Very good evening.
So, getting to this debate that I spoke about at the beginning of the show. Lockdown, save the lives of the people, or no lockdown and save the economy of Sri Lanka? Let's start with the first question. Professor Indika, well, we are currently experiencing a partial lockdown situation. Travel restrictions have been imposed, and tomorrow these travel restrictions will be relaxed to a certain degree. What are the advantages really, and is this really the need of the hour to impose travel restrictions amid the COVID-19 pandemic in the country?
Yes. First, what I had to say is drastic situations call for drastic measures. Are we in a drastic situation? If you look at the numbers, with about 3,000 patients being reported and several people dying, and the hospital system and the wards and beds being overcrowded, it is actually a drastic situation. Sometimes even more drastic than numbers would say. At the moment, even though we see about 3,000 or slightly more number of patients, when it comes to PCR positives, the actual number could be even higher.
Right.
Because of the delays in PCR and other factors, the actual number in the community may be even higher, maybe about 2 times or 3 times more than the numbers that are reported.
Right.
Another thing is, the situation that we are seeing is actually what was there a few weeks ago. Again, due to the time period of the PCR delays, and also this disease, once contacted, takes about up to 1 to 2 weeks for a person to get infected and show symptoms. And also another very important crucial factor, that once someone gets the infection, it gets about 4 weeks time for them to have complications and maybe unfortunately die.
So, Dr. Anil, on that point, now this debate, the debate that I spoke of at the beginning, it seems as if Professor Anil's health sector has won this debate. Lives of the people come first. But can the economy of Sri Lanka really sustain this 2-week lockdown?
Yeah, it's like this. When it comes to this lockdown issue, just take a situation as of now. So we are not in a really full-scale lockdown situation. So in a way,
But what's really the difference between a full-scale lockdown and travel restrictions? I mean,
yeah, so full-scale lockdown. So you are not allowed to move. In a way, travel restrictions are there. So most of the economic activities would be really halted, and by and large, so country would be in a defunct position. So that would be the situation. But so during this 1-year period, so after the COVID, no matter whether we experience some difficulties, to great extent, the ordinary mass, general public, even small scale manufacturers, business people, or whoever who contribute to the economy are paying the big price. But amid this situation, what has happened on the other hand, only the big people, big companies, but they are very few in numbers, so they are cashing it out, they are making lots of profit. Right. So therefore, in my analysis, my view is that the lockdown for 1 week or 1 month is not going to make a big difference in terms of economic losses or any other things in our Sri Lankan economy. Because to be honest, if you analyze Sri Lankan economy, what an economy do we have? Like, so because in a way, very poor economy, there is mismanaged in a way.
Right.
So many lots of issues are there that is very apparent. So such a situation, in terms of health measures and the gravity of this particular issue is considered, actually lockdown would really save that. Finally, what matters is the lives of the general public and not the, so it cannot be measured in rupees and cents. So therefore, that could be recovered for sure. It would be short term, so for sure. But this is not something that is inherent to our economic system, the production process. This is an external shock. Then we have to defer our economic processes. I think from macro point of level, it is always good. But sometimes people argue, so against this lockdown, so they either they are not visionary or they think of their short-term benefits.
They don't see far enough.
Far enough, because they think on their only personal profit. Because just imagine, like, see, lots of evidences were there during maybe last couple of
During
months.
the New Year season,
New
the
Year
requirement
season,
for a lockdown.
Even lockdown period, so just people were trying to maximize their own interest, so make profit out of this. So they wanted to convert this crisis situation to an opportunity for them to earn profit. So that is the bad part of the story, because if we want to have a solution for this thing, actually there is only one solution. It is a collective solution, because this crisis is everywhere, so you should not think of gaining profits. So that is the problem lies in the case of lockdown, because when it is lockdown, actually to poor people, ordinary people, whether it is lockdown or not lockdown, so they are having a hardship. So they can really drag it for another 1 month or 2 months, no problem. But on the other hand, actually government should come in front and they should really act as a mediation. But of course, we have to understand the fact that our poor policies, the government situation, we are badly indebted. So country's debt level is 101% of the GDP. So suppose that before having a crisis, we have been doing so many unnecessary things, lots of waste, corruption.
The projects that we conduct have no return on investment.
Return on investment, and on the other hand, this is the time where we need to borrow money. Now you are not in a position to borrow money,
because we've borrowed for unnecessary things in the past.
Unnecessary and lots of waste, corruption, so many things are there. Now in a crisis
Dr.
situation.
Anil, I'll get back to you on that, on the economic front, but moving our attention to Professor Indika for a second. Professor, lockdown is only one aspect of curbing the spread of COVID-19. We can't just imagine a lockdown and expect everything to go back to normal. On the other front, let's take a look at what the Ministry of Health has done today. They have issued guidelines making it mandatory for people who seek to test themselves for COVID-19, for a PCR test or an antigen test, to get a recommendation from a doctor before they go and get this test done. Do you believe that this kind of obstacle, this regulatory measure, is above and beyond and really taking us back on the objective of curbing the spread of the virus?
Yes, it seems so. Once you look at it superficially, it seems so. Why are you trying to reduce the number of PCR when we say that the current number of PCR is not adequate and the number of patients being reported or tested positive is much less than the actual number of patients. So why this decision to put more restrictions? Now we have to look at it in this way. At the moment, when you do a PCR, there are some delays when the PCR results come. That becomes very problematic when it comes to decision making. Because at the moment we don't know what's the real number at this moment. We can only make estimates. So the obvious answer may be increase in the PCR number or testing capacity. But PCR testing capacity is not just increase in the number. Like for anything else, country has a capacity for PCR. Not just doing testing, because you need the technicians, laboratories, equipment, everything. If the number of samples that you take exceed the testing capacity of the country, it sends the whole system into chaos. Because there will be delays, and the priority samples may not be tested. Some samples that are not priority, like routine, might get tested. The whole system goes into disarray, and that will lead to delays in results. When there are delays in result, then the figures that we are getting will not be very much helpful for decision making. That is why it is very important to work within our capacity, because if you exceed our capacity, the whole system will go into chaos and it will collapse. Therefore, it's very important to go for a targeted rational testing. That is why this recommendation comes, because now you can reduce the unnecessary testing and make it very targeted. We are trying to make use of the limited resources that is available.
In the best ways possible.
In the best way possible. This is not ideal. I am not telling this ideal. But this is the country's capacity at the moment.
And under the circumstances, this is the best
Go for a targeted rational testing, then you can get quick results, because you need to get the results within the same day. Otherwise, you can't make decisions.
Before we cross into a short commercial break, I'd like to pose this question to Dr. Anil. Doctor, we heard rumors, we heard whispers of plans to import luxury SUVs for parliamentarians. Now, in addition to these SUVs, of course, there were also plans to import ambulances and other double jeeps for various other government purposes. But now we also learned that the cabinet has made a decision to suspend the import of these vehicles. All of those matters aside, I mean, to even think of importing vehicles for parliamentarians at such a juncture in this country. Now, this decision, there was an initial decision to import the vehicles, and that's the reason why the cabinet had to intervene and cancel that decision. As to who made that decision to import vehicles, well, it's a parliamentary privilege, and we only can assume that Parliament was behind this decision making. I mean, is this really at least viable, required in any way? Is there any sort of justification? The justification from the part of the ministers usually is that, you know, we need our vehicles to serve the public. But does that fly this time?
Yeah, that's like actually for any bad cause you can bring justification.
Okay.
But it is very indicative. So just for a layman, you can understand the crisis situation like this. So how essential these things. So it is not really, but it shows the interest of the government, because their interest is only themselves and not the nation's interest by and large. So that is why they have been very carefully, shrewdly, this particular importation includes 50 ambulances as well. So that is their justification, just to justify, because we are going to, because one minister appears on the television and says that now this is a very critical crisis situation, we want to fight against the COVID, therefore we need vehicles. So we are going to use actually, so professional like Professor Indika and also in the health sector, you know that, so what is most important, if it is really critical thing, it's all right, but it is pretty obvious, anybody can understand that is not the critical thing. The critical things are the medical facilities and the vaccinations and all these things. So the government had not made any attempt to acquire vaccinations, because in the world, either we like it or not, as of now, out of the total production of vaccinations, countries have already ordered. So there is another concept has come into the practice called vaccine nationalism. So even the nationalism is a bad thing, but in this particular event, each country tries to protect their own nation. UK has ordered 5 times vaccines against,
so that whenever the first batches come in, they can vaccinate their people.
Vaccinated. So they can do this thing, because that shows their interest and intention and how they govern the general public. In our case, we have not done anything. We are just begging now. We depend on others' mercy or whether others can give something. So that is really bad governance. That is what I'm telling.
Well, as a member of the general public, to me, it was in the very least ironic the fact that the minister in charge of COVID-19 requested the general public of Sri Lanka to come forward, donate, support the COVID-19 drive in Sri Lanka to battle the COVID-19 pandemic. And then there are at least even rumors. There is no permanent decision. I must make that clear to all our viewers out there. There is no permanent decision to bring down these vehicles. But even rumors of this decision, LCs being opened up and loans being obtained from the Bank of Ceylon, and then subsequently being cancelled by the cabinet of ministers. Even whispers of these really puts a dent in the trust that we have placed in our leaders to protect us from this pandemic. With that, we'll cross over to a short commercial break. We'll be right back on the other side. Don't go anywhere. You're watching Newsline Live.
Newsfirst, Newsline.
Welcome back. You're watching Newsline Live on a very interesting discussion on whether the country should continue to remain in lockdown or if we should move towards a relaxation of this lockdown so that the economy can be saved. It's the lives of the people or the economy. And continuing our discussion, Professor Indika, this next question I pose to you. Once again, like I said before, lockdown is not the only measure that any government in the world takes to control the pandemic. There are many other important aspects. We spoke about the testing aspect and how the guidelines that were issued today really affect the reality of the situation as far as testing, conducting PCR tests and antigen tests go in Sri Lanka. However, there is another concerning matter that I need to draw your attention to, Professor, and that is the flow of information regarding the COVID-19 pandemic in Sri Lanka. Now, the first step in solving a problem is identifying that there is one. And the flow of information really allows the general public also, and especially health professionals, to get involved in the process of identifying these problems. However, a recent circular that was issued by the Health Ministry has barred all members of the ministries and other government organizations to release information to the general public without prior approval. Do you think this is fair?
Okay. It depends on what kind of information that we are providing. And like you very correctly mentioned, correct information is very important in this kind of situation because people need to be aware and you need to take action, and for that correct information is required. As health professionals, I don't see any reason why we should be restricting providing correct health education, correct advisors and correct education in a situation like that. That's the responsibility of all the health professionals, provided we are giving the correct information. Because sometimes you see a lot of misleading information and contradictory information is also going around. So there need to be some way to control this contradictory information. And when it comes to official figures, official situation, I think it would be ideal if there is one professional official spokesperson who can provide the situation. For example, the current situation has to be provided by one official spokesperson who is competent. In that way, there would be less confusion and more clear cut. In that way, yes, it is correct. But on the other hand, about providing good health education, correct health education, I don't think there should be any kind of restrictions.
Well, Professor, I can relate to you one dilemma that we're facing. We provide a lot of space on our programs here at this network to members of the public health bureaus, the Public Health Bureau and Health Promotion Bureau, I beg your pardon, the Health Promotion Bureau, many other institutions like that that are tasked with the responsibility of educating the community on matters relating to their health, not only COVID-19, but issues like the dengue issue that will also crop up soon with the onset of the southwestern monsoon. But now the space not only for information related to COVID-19, but information related to other diseases as well is being restricted by this circular.
Yeah, that I think is not very helpful because you need correct evidence-based, science-based information in this situation. And then the question comes, who should be providing those information?
Professor, before I move on to Dr. Anil, one last question to you. Do you believe that it would have been better if the Ministry of Health would have introduced a scheme or a circular at least to take responsibility for the statements that you make to the media? So if a member of the Ministry of Health or a member of any other public organization comes to the media and makes a statement, they are responsible for that statement. And now action has been suggested under the Establishment Code for any views that are expressed to the public without approval of the government. But don't you think instead they should have introduced action for false information that have been released to the public under the responsible positions that they hold?
That definitely yes. So everything depends on what kind of information that you are releasing, whether it is based on science and correct evidence. Yeah, in that case, yes, definitely. And there are different types of levels, like organizations are there, professional associations are there, colleges are there, then trade unions, then individuals. So they have their own limits and responsibilities. So they should be able to provide information within their limits. I think at the same time, it comes a lot into the self-responsibility. Like, I mean, taking responsibility into what you express or what you say.
Dr. Anil, if I can grill you a bit on this decision that was made, the COVID-19 fund, the Itukama fund that was established, had spent a majority of the funds allocated in the Itukama fund to public awareness. We as responsible media organizations provide this for free on our stations to educate the general public for the benefit, for the greater good of the entire society of Sri Lanka. But however, again, this has been restricted by this circular. And also, the Itukama Fund is spending a majority of their funds on public awareness. Does this augur well on an economic standpoint?
Yeah, that's what, again, like whenever the politicians hold kind of agencies, whenever they hold agencies, so enormous power is, accumulated power is there. So it is the responsibility of them, and again the responsibility of the general public as just to make sure that the common funds and the things are taken care of very well for the benefits of the general public. So in a way, so Itukama fund or whatever, if some fund has been collected for a common cause, it is a health crisis. So what are the priorities? So if you ask a question, it seems to be very clearly just making awareness programs. Spending lots of money is not going to solve this problem. Is it something related to the awareness? No, it is now. It has spread everywhere. So as the medical professionals say that the vaccine is going to be the main remedy for this thing. So therefore the money should go for the right thing. So this is a problem of prioritization. Even the issue with this the Itukama fund shows the government doesn't know how to prioritize the things because they think only their personal interest. So because you can't expect more than that from these kind of politicians, because so politicians or whoever who rule the state should have adequate education, knowledge. That could be the reason why even Plato said to rule a state or country, we need to have a philosopher king. It means it highlights the importance of the knowledge and the education. So now you look at so what kind of rulers we have. Actually, I'm not blaming them. This is our choice. This is a democratic process. But we have to accept this fact. When we are in a hell, but we are talking about a heaven like so, this is how countries are ruled. But we are in a real hell. So this is the quality of our politician. And again, people are also ready to just deal with this situation, divided into so many camps. So in such a situation, politicians can easily turn one against the other. So based on so many grounds, it is really bad. It is not going to solve this particular issue. Either we have irrespective of the differences that we have, at the end of the day, now anybody can understand and realize that this is a common issue because this health issue is really attacking
and the only
everyone.
way that we can fight this pandemic is together.
Otherwise there won't be any solution.
Thank you very much, Dr. Anil, and also Professor Indika for joining us on our show this evening. Dr. Anil, on what you said, one final statement that I would like to make is the fact that what you said, the fact that it's easy to divide the general public on their differences, especially during a pandemic, was that when the government initially said, depending on your political persuasions, your requirement of your idea on whether there needs to be a lockdown or whether the economy should continue also changes. So I saw that also a lot on social media, and that definitely supports your point on how the country might divide during this time of the pandemic. And also it highlights the importance of unity for us to battle this pandemic and come out of this as one nation in one piece, of course, hopefully in the foreseeable future. as soon as possible. Thank you very much to all our viewers out there. Once again, thank you very much, gentlemen, for joining us on our show. There were many questions that I received from ardent viewers out there. Unfortunately, I apologize, as I could not have posed them due to the time constraints. But do stay tuned to Newsline. I will make time for this during our next program. Until we meet again, take care and God bless.